The reason is that when you see these celebrities, you know that on camera, there is so much of filtering, so much of makeup, so much of lighting that is actually playing a good role. But these children don't understand that. They feel that what they see is the real thing.
So, what about Botox?
Botox is a trade name. The actual content is called botulinum toxin. Botulinum toxin is a medicated, it's like a drug, which when injected into the muscle, temporarily paralyzes that muscle from doing its activity. So mainly it is used for beauty. So why it is used is when people get frown lines or forehead lines, which make them look older. Then Botox is injected into these muscles, which temporarily makes those muscles, paralyze, or maybe we could say they stop doing that increased movement that they were doing earlier. So yes, monkeypox is slowly getting to be an epidemic. It started with some parts of Africa, and because of the migration and the travel that we all have seen, obviously in the recent years, even post COVID, the travel has increased quite a bit.
So, speaking of these abrasions, there have been actually a rise in the cases of skin cancer. Welcome to yet another exciting episode of Seeds of Soul. Today, we are thrilled to welcome Dr. Kruti Banodkar. She is a clinical dermatologist, trichologist, and a clinical dermat. She is here to bust myths about skincare, and we are very excited to know more about the evolving beauty standards in India. So please join me in welcoming Dr. Banodkar to Seeds of Soul. Thank you, Dr. Banodkar. Thank you for taking time out to join us today on Seeds of Soul. I'm sure that we will be very enriched by your insights into skincare, and I would just want to start our conversation by the age-old question: that is India still obsessed with the white skin, especially in the urban population? What is your take on that?
Okay, so thank you for the question. It is definitely a burning question these days. So, age old times have told us that people are actually after fairness a lot. But now, with the recent education that has been created or awareness that has been created on social media, many people are moving away from just the fairness bit when it comes to the skin. They are looking at health. The health of the skin is more important. So, I've been seeing that there is definitely a change now. People are more acceptable towards darker skin, different skin tones. So that is the change that I'm seeing now. But however, the fairness creams that still exists. There is a population which would like to use fairness creams because they feel that they need to be fair because they'll be socially acceptable if they are fair. However, we try to tell them that that's not what you should be looking at because it's not always easy to change your skin color. We can get you to where you were. We can't go beyond that. Hence, it's really important that we tell people, maybe rural or urban, whichever populations, that they need to actually look at improving their health, improving their skin tone, rather than looking after fairness. So, this is what I would say.
That's wonderful. So, what about the teenagers' obsession with the cosmetic procedures these days? What is your take on that? I mean, is it really okay for a 14-year-old to be asking for, some kind of cosmetic surgery? And I'm sure that you must have come across such cases. And it must be a fine balance for you to walk on. How do you tackle such cases? And what is your opinion on that?
Okay, so yeah, definitely. Now, with the recent trends of Insta and social media, there have been so many young children coming to us asking for various procedures or creams or treatments that they can do to enhance their skin. Sometimes, when you look at their skin, you feel that actually there's nothing that's gone wrong. The skin is perfectly fine. Maybe there are a few blemishes, or maybe there is a little acne, which is bound to happen at that age. But not all of them understand that. They want to look good. They want to actually
Have that confidence.
yeah, they want to have the confidence definitely, but I feel that when they see influencers, when they see celebrities on social media, it is like kind of an ambience that is set up which tells them that you need to look good, you need to do well with your skin, to show that, that they can go ahead in life. So that is what we try to tell them, that that is not how it should be. You should not be running after, just getting good skin by looking at these influencers or celebrities. The reason is that when you see these celebrities, you know that on camera, there is so much of filtering, so much of makeup, so much of lighting that is actually playing a good role.
Yeah.
But these children don't understand that. They feel that what they see is the real thing. So sometimes you have to tell them that. I actually tell patients, I counsel them that, see, what you saw on the screen was not real. It had a lot of layers of makeup, of filters, of light, which actually got them to be that way. So don't run after it. So that is what we tread on.
So, Dr. Kruti, from your recent Instagram post, I saw that you were a guest at the Ambani wedding, right? And I'm sure that you saw a lot of celebrities up close. And speaking of celebrities, do you think that there is a lot of insecurity around looks amongst celebrities?
Okay, so definitely because they are on that platform, they need to put their best foot forward. So I'm sure that they are very, very particular about their looks, is how I would put it. Now, when I went to the Ambani wedding, I definitely had a very good experience. It was an experience of a lifetime, I would say. So where I was standing, I had a good vantage point to look at all the celebrities that were coming in. And it was very nice to see all of them. They all were dressed in their fineries with their skins flawless and looking their best. It was definitely a different experience. I think I was in awe of all that even after 2 days post the wedding.
I'm sure.
So it was definitely a great experience. Now, when I talk about celebrities, we do have some celebrities coming to us asking for various kinds of treatments because that's their need. That's how they present themselves to the world. So they are definitely a little finicky about it, but I wouldn't blame them for it because they want to look their best in front of the camera. So there are a lot of celebrities who would do a lot of skin treatments, but it's a lot of effort also on their part to maintain a good skincare routine. Just doing a treatment is not enough. We need to also maintain it, and the maintenance has to be daily. Just like how we would tell a person that brush your teeth twice a day to maintain your teeth. Similarly, we tell a person that you must actually take care of your skin daily. We know it takes a little bit of time, but anything that has to look good has to be given some time. So that is what these celebrities do. They invest a lot of time and energy in skincare, which I feel is fair. And some people do undergo a lot of plastic surgeries. Some people do non invasive treatments for skin, which I think, depending on their requirements, is a fair thing
Correct.
these days.
So, what about Botox? Is Botox something that can be taken by anyone, or it should be taken strictly under advisory?
So ideally, when a Botox is injected, so Botox is a trade name. The actual content is called botulinum toxin. Botulinum toxin is a medicated, it's like a drug, which when injected into the muscle, temporarily paralyzes that muscle from doing its activity. So mainly it is used for beauty. So why it is used is when people get frown lines or forehead lines, which make them look older, then Botox is injected into these muscles, which temporarily makes those muscles, paralyze, or maybe we could say they stop doing that increased movement that they were doing earlier. And the skin looks pretty, it looks tighter, it makes you look younger. So that's the whole idea about Botox.
But then those celebrities, who have got this done, you can't tell, their face becomes quite expressionless.
Yeah, sometimes you can understand that this person has had the Botox. Correct. Because when they emote, then the eyebrows will not like really rise up or things like that. But when it is done in the correct way, it doesn't really show up much. So that is why it is important. That's why your question is really important, that it should be done under a dermatologist guidance, wherein they know exactly how much to inject, what will look good, what will not look good, and hence it cannot be done by anybody.
So there are cases, where I saw internet celebrities or influencers, they injecting them, getting Botox injections done at a young age of who are below 25 years of age. Do you think it's advised? Is there a certain age criteria that should be kept in mind while going for Botox?
No, honestly, there's no age criteria. There is no contraindication to Botox as such unless the person is allergic to that ingredient. Otherwise, there's no age criteria. If a person feels that they need it, if they're getting some lines which they don't want to show, then it's fine to use Botox. There's absolutely no problem. But usually, when the person is younger, they don't get these kind of lines and wrinkles. They don't need it when they are young. And that is why we have termed it as an anti aging procedure. That means that when you grow older, you might get fine lines and wrinkles which need correction, which the Botox is used for.
Correct. And now, speaking of, we have spoken about clinical procedures that one can undertake to stop anti-aging processes. But there are a lot of anti-aging treatments, or or DIY treatments that people do at home, and sometimes they borderline on bizarre. If you know what I
Absolutely.
mean.
Yes.
Like, for example, using Colgate for pimples.
Absolutely.
Okay. Do these DIY hacks for beauty treatment have long-term effects? And what is your take on that?
So, what I usually tell people is that when you're doing something DIY, you have just heard about it. Somebody has just told you that Colgate lagalo, it will help your pimples. But you don't really know that what's going to happen post that. So, we had an incident where a person came to us literally looking like a zebra over the face, yes, because there were lines which were brown and then there was normal skin in between. They had apparently used Colgate and garlic and whatever they could mix for their pimples. And when they came to us, the skin had burnt in the layers that they had applied that. It was actually looking like a zebra. So it took a lot of counseling, lot of effort to correct that. So that is why I tell people, if you're doing something DIY, it better be something which you know for sure that is going to suit your skin. Because not everything that is DIY, which is organic, which will suit your skin. So garlic is organic, but it didn't suit that person's skin. It literally burnt the skin. So hence it's very important to understand in a DIY what is your skin's needs and how will it affect your skin. So if you talk about a long-term effect, if this person had burnt his or her skin, it would have caused marks which would have been there for a longer period of time. So that way the long-term effects are present. But if you see internal effects with organic products, they don't exist. But however, for the time being, the burnt skin definitely gave a lot of heartburn to that patient. The patient was not happy. And that is why every DIY should be viewed with caution and just not used because you've heard somebody telling you that it's going to help you. So, better to take a dermatologist's advice and understand what is the type of your skin and then start using the products. So, you get to know what's appropriate for your skin.
Yes. So, doctor, that talking about all these procedures brings me to the next question. That there has been a rise in clinics that offer services like microblading and lip blushing, like a semi-permanent makeup. What is your take on that? Are these procedures safe for patients?
So, it is okay to do these procedures provided they are being done by somebody who knows what they are doing. But we do it with a little caution because any kind of pigment that is injected into your skin, which is literally happening in these procedures, be it the lip blushing, that is where a pigment is being put into your skin, it goes deeper. And even in microblading, there's a pigment that is put into your skin, it goes a little deeper. So these pigments can sometimes cause foreign body reactions, they can cause granulomas. So I wouldn't say that they are completely safe, but when done under the correct guidance, they could be okay to do. But I would say that don't try and get into it because any pigment that is injected might have a reaction. So it is better to not get into it.
So, is there some kind of a patch test that can be done before?
No, that's not easy because these pigments are being put inside the skin. So any patch test would be more external.
Correct.
So it would not give us a clear idea.
So, it's best to just take.
Yeah,
care
it's
of
best
it.
to be clear of it and to be natural. And so if you feel that your lip is pigmented, there's always means to correct that pigmentation. So the dermatologist can help to correct that pigmentation. That will be easier to do, safer to do. A lot of people do microblading these days. Mainly salons do it, they indulge in it. People say that they are happy with it, but over a period of time, it does give a greenish hue. You can understand, okay, that this is a pigment, this is not the eyebrow. So those are the things that people face, but most of the people want to do it because they have sparse eyebrows. So we don't really discourage them from microblading as such, but lip blush is something that I would say refrain from.
So, Dr. Kruti, our conversation would be incomplete if we don't talk about the value of having nutritious food and skin.
Sure.
And also, if you could share your thoughts about having 3 liters of water a day, does
Sure.
that really lead to clear skin?
Yeah, it does help. So having a lot of water will definitely aid in not only clear skin but a lot of other bodily functions as well. So it's very good to have 3 liters of water. That is what I traditionally tell all my patients. Have 8 glasses of water or have 2-3 liters of water every day. So, how it helps? So, basically, it helps to clear off the toxins from the skin. So, because of that, the skin starts looking brighter, well hydrated. So, that's how it helps. It sometimes also improves the elasticity of the skin, it improves the circulation of the skin. So, definitely having water is a good thing. Plus, it adds to the minerals. So, there is sodium, there is sometimes potassium, etc., in the water. So, that also helps to enhance the skin. So I think it's good to have good amount of water every day.
And which vitamin should we focus on for having a good skin?
Sure. So vitamin C is very vital for the skin. So that really helps to improve the skin health. In addition to that, we believe a lot in antioxidants for skin health. So any fruits which are colored, like pomegranate, red bell pepper, yellow bell pepper, tomatoes, they contain lycopene. So all these are very important ingredients in maintaining skin health. So having foods rich in this will definitely help enhance the skin health.
Correct. And also, there has been a growth of collagen supplements in the market for a healthy skin. And there have been brands that have been also saying that, these are vegan collagen supplements. Do vegan collagen supplements actually exist?
Yeah, they are plant based basically. So that's how they say that they are vegan. There are collagen supplements which are derived from plants.
Take them?
One can take them, they are helpful. So when you're taking them, definitely your skin improves, the way your skin elasticity is, the way your skin glows, everything improves. There's no harm in taking it. But the only thing is, once you stop taking these supplements, you will go back to square one to where you were. So one should not expect that when I'm taking these supplements, it's going to keep lasting forever. That's not going to happen. It will slowly get back you to normal if you stop taking these supplements. So when you take it, you can take it with that information in mind, that this is not like a permanent change that I'm getting in my skin.
So, doctor, there has been a recent scare or a development that has come up called monkeypox, which has lot of abrasions. Those pictures are really scary to look at. Is that something of a next epidemic that is coming along? Is that something that we should be worried about? And what kind of precautionary measures can we take regarding that?
Sure. So yes, monkeypox is slowly getting to be an epidemic. It started with some parts of Africa, and because of the migration and the travel that we all have seen, obviously in the recent years, even post COVID, the travel has increased quite a bit. So that way, the epidemic could spread to the other parts. Uh, it is not very surprising if it comes in the near future to our city or our country. It might come. It's unpredictable.
So, in India, there has been no case of monkeypox.
I don't know if there have been any recorded cases or not. I last I heard was a case in Pakistan, but I'm not sure about India at the moment.
Thank God.
So we are keeping our fingers crossed, because the dermatologists are going to be the frontline warriors, I think, when it comes to that, if at all. We are hoping that it doesn't. So any person coming with nodular eruption, so that's what happens in monkeypox. We see small cysts or nodular eruptions, more like, they are skin colored raised lesions, elevated lesions, I would say. Uh, as you mentioned, they don't look very appealing, definitely, but
They look scary.
so
Do
yeah,
they go
so
away after?
they do go away. It's a viral infection, so it will resolve. It's not something that's going to stay forever, and it is not even as scarring as the smallpox. So we are looking at an epidemic where people might get these lesions, but they will resolve with good treatment. So we are looking at symptomatic treatment to help them resolve, and it would subside. But when it gets to be an epidemic, so the epidemic spreads, the transmission happens, so many people get infected with it. So that is what we are dreading, because obviously we need to take measures to prevent that at this stage. So whenever it comes to that, we will be ready with the measures. The already, as you're aware, you're making this an awareness amongst people. So that's a good thing. So it's important to make people aware at the moment that if you see the smallest signs of it, do visit a dermatologist so they can rule out monkeypox and they can give you treatment for the same. So we can definitely control it, but it might take a while if it becomes an epidemic.
So, Dr. Kruti, I'm sure that you must have come across many bizarre beauty standards also, right? Are there any such current practice that you would like to say that, just finish it already, be gone, be gone from the scene because this is like the worst ever?
Well, maybe because I'm in an era where, there's so much of knowledge and awareness, and, no machines have come in.
Correct.
So we don't see these practices so often now. But in earlier times, definitely there were things which were used, which were more cruder.
Correct.
So there used to be skin dermabrasion, and dermabrasions used to be very, very crude.
Could you describe that in layman's terms?
Yeah. So what happens is, whenever there was a patient with, say, acne scars in the olden times, they would take an instrument which would be rough on one side, and they would derm abrade the skin. That means the layers of skin would slowly be rubbed on, and it would make the skin raw for a few days, such that the patient would not be able to go out into the sun, expose themselves to sunlight for at least 15 to 20 days. The skin would be red for a few days. So these were more cruder practices that were carried out to treat things like acne scars earlier. But now with the recent advances in technology, with lasers, so we have lasers to treat acne scars, which are more, I would say, cosmetically appealing. It wouldn't cause so much of inflammation, so much of redness that the person can't just step out for 15 days into the sun. So these are the advances that we've seen now. But yes, there were times in the olden times, as I was mentioning, that such crude things used to be done that, now we feel that it's a good thing that we have come away from that and progressed.
So, speaking of these abrasions, there have been actually a rise in the cases of skin cancer in the recent past. What do you think contributes to such a rise, and how can one stay safe, and what are the safety measures that one can take?
Yeah, so basically, skin cancers may be on the rise, but thankfully, they are seen more in the Western populations because their skin is made in such a way where they have less number of melanocytes. Melanocytes are actually the pigment cells. So that is what Indians or Asians have in their skin, where we are brown skinned because we have more number of melanocytes in our skin. So we have the natural protection against skin cancers. So we are the lucky bits. We are the lucky ones, I would say. Though we tan a lot, our color darkens because of the sun exposure, but we don't get skin cancers so often. So, whatever's been on the rise, we've seen it in the Western populations because they have this habit of tanning. They love tanning, which is not good for their skin because the tan is actually causing the skin cancer to progress in their skin. So, you may have heard of people actually going out for sunbathing, or they are using tanning beds. That's in the West. So that's where they tend to get more skin cancers, and that's where the awareness has, we are trying as dermatologists. The globe is at our, at our hands. So we there are people who connect with us even from abroad, and that's when we try to give them this knowledge that do not use sunbathing or tanning beds, just to, they like that dusky color because they are on the fairer side.
They want our natural color.
Yes. So I would say the grass is always greener on the other side.
Yeah.
But that's when we try to bring the awareness in those people.
And what about our overexposure to gadgets, to screens, especially in the cases of children? Have you seen any uh, adverse effects of such exposure on children?
Absolutely, not only on children, even on adults. I mean, the entire population is now in front of gadgets all the time.
Correct.
So, very recently, there's this lady who came to me and said, Doctor, I am working from home post COVID since the last 4 to 5 years. Why is my skin so tan? I'm not just stepping out in the sun. My working hours are such that I start early in the morning, I finish late at night. Why am I so tan, doctor? I said, the answer is very simple. You're working from home, you're in front of a laptop all the time. The radiation is getting to you. That's how you're tanning. And she was really shocked to know that. She had no idea. She would not use a sunscreen thinking that she's indoors. But that's where the actual crux of the situation is. Even when you are indoors, on any day, even if you're stepping out, say on a rainy day, you need to have a sunscreen on your skin. And that's going to protect you from sun rays, UVC rays of the sun, which can pass through cloud cover, from tube lights, from phone screens, computer screens, and even cooking gas. That can also lead to tanning. Hence, the sunscreen needs to be worn at home, even when you're indoors, for the entire day, and preferably at least twice a day. Because when you use a sunscreen, the effect will last just for 5 to 6 hours. After that, the sunscreen's effect goes down. So, hence, you need to repeat it. So, this is what I tell everyone. And when you ask me about children, definitely children are facing it. I was very surprised to see a 10-year-old come to my clinic yesterday. And when I saw her, she seemed fine. There was no acne, there was nothing, no infection. And then I asked her, Mom, why has she come? She said, Doctor, wo thodi tan ho gayi hai. I said, but she's 10 years old. She said, huh, but she's so conscious. She's after me to buy skincare masks and she wants some products. She sees Insta the whole day and she's forcing me to buy the Alia Bhatt skincare routine and some snail mucin. So, what should I do, doctor? I said, okay. Then I counseled that girl. I said, baby, you're young. We don't want you to use these products right now. You don't start so early. Your skin is sensitive. Your skin is very delicate. So hold on. It's okay if you've tanned. Start using a sunscreen, which is good for you. So in children, we give physical sunscreen. We don't give chemical sunscreens.
What is physical sunscreen?
Yeah, so physical sunscreen consists of zinc oxide, which is just like a barrier. And chemical sunscreens contain other chemicals which help to protect against the sun. So for children, we are very particular. We just prescribe a physical sunscreen, just like a barrier to the sunlight. And that helps to give them the sun protection. So then I advised her that you use just the moisturizer and sunscreen. Don't get into any of these beauty products. And she was not very happy with it. But then she said, okay, doctor, I will do this. And while going, she said, just tell me the name of one mask, na doctor, one sheet mask which I can use. I said, no, you can't. You're too young. You just cannot. Please. Then she said, okay, theek hai. So
Okay.
then, I'm
I think
sure.
you brought a lot of peace between mom and daughter.
Mom was very happy. I
I'm
don't know
sure.
what she
I'm
faced
sure.
after she went home with the daughter, though.
Yeah.
So this just happened last night. So that's how children are getting really influenced, and
Really
yeah,
influenced,
absolutely.
yes.
And they want to look good, and the gadgets are also obviously tanning them, but sunscreens are enough for their skin and moisture.
So this recent, this um, so this craze for actually looking perfect all the time must be creating a lot of mental load. Also must be creating a lot of mental load on the children. Obviously they are already burdened with studies, extracurricular activities, and then they have this social image also to maintain. I'm sure that this creates a lot of stress amongst the younger population. Have you ever come across such a case where you had to actually refer them to a psychologist, maybe because this case has gone you know to a next level only?
Yes, absolutely. And I face it day in and day out. So I definitely try to counsel them. There are these children who follow the social media influencers like step by step. So they will come and tell me, give me XYZ skincare routine. So it took me a lot of effort to explain to them that look, what is on social media necessarily is not true. So if there is a celebrity telling you that this is my skincare routine and I use, say, I use a brand which is a foreign made brand and I use it for my face wash and I use it for my toner and I use it for my moisturizer, it's not really necessary that that celebrity is using it. And the effect that you're seeing on screen is not because of those products. The effect is because of makeup. So it took me a long time to explain. I mean, it happens many times. So it is one particular child around 13. Mother says, Doctor, see all these skincare products that she has bought. She makes me order from Insta. And I am just compelled to order because then it's otherwise she's very angry. So look at it. And she got a big bag out and she showed me all the products from different brands which she had seen on Insta and bought. And then mother said, I don't know what to do with this girl. She just will not listen to me when I tell her not to. So can you please guide her what is good from these products, what she can use? So then I had to counsel her and say that don't think that this product is going to work like magic. There is no magic in skincare. There is no product which will give you a miracle skin. You have to work for it. You have to have a good skincare routine. Use the correct products according to the type of your skin, and then will you see the effect. So that girl was a little convinced. She agreed that she will not buy any more products from Insta. Though I didn't have to refer her to a psychologist. I think my my counseling was enough. But she had gone through that, and they really don't know that what they are seeing is not true. I mean, when I see an XYZ celebrity, I know that okay, her skin is not the way it is showing on the screen. Oh, she has covered her imperfections with a lot of makeup. but that the younger generation is not understanding. So that is where, we need to create more awareness. So what you're doing right now by asking me these questions is definitely creating a very good awareness. So I would thank you for that.
Thank you so much.
Yeah.
So, Dr. Kruti, you actually shed a lot of light on this young girl's obsession over beauty brands and, how she buys these products, OTC products from Insta. But there are some pharma products that are actually recommended by Dermat. Do these products work equally well, like like a dermatologist recommended brands, or one should only stick to what the doctor says?
Okay, so I would rather stick to what the doctor says, is because when I give a patient a product, I am seeing the skin of the patient, understanding the needs of the skin. If there is an issue regarding acne or pigmentation or dryness of the skin, I will address to that concern with actives. So the products which I would recommend would contain good amount of ingredients which the patient will benefit with. So that is how.
So, thank you so much, doctor. I think that I have walked away with a lot of wisdom and insight into skincare, and I will be very careful to to slither myself with lots of sunscreen when I sit in front of a screen. So,
Good.
thank you so much for this. Are there any parting notes that you would like to share with our audience?
Yeah, sure. So I would like to say that believe in yourself. If you have any type of skin, not any type of skin is bad or good. You have to work to make it good. So work on your skin, make it better if you feel that you lack somewhere. But don't think that because I have an oily skin, I don't look good, or because I have a dry skin, I don't look good. That's not how it should be. You have to work on your strengths. You can always make changes in your skin with the correct ingredients of products that you use, with the correct treatments that the doctors give.
Yes, thank you so much. Thank you. Thank you. Yeah, thank you so much.